Good evening, doctors. Welcome again. Our today's topic is fibromyomas. Fibromyomas are leiomyomas, fibroids, or simply myomas are generally benign. They are benign in nature, uterine neoplasm. Commonly encountered in gynecological practices, 5 to 20% of women in reproductive age. They are slow growing tumors and take 3-4 years to be clinically palpable. Unlike ovarian tumors, the presence of myoma causes hyperplasia of the myometrial wall, the cavity of uterus. So, the cavity of uterus is often distorted and enlarged. The endometrium tends to be thicker due to endometrial hyperplasia. The ovaries at the time of enlarged, cystic, and hyperemic with evidence of salpingo-oophorytis, about 15% cases. Cervical submucous and broad ligament fibroids are usually single. Interstitial and subserous fibroids may be single or multiple. Remember, vary in sizes seedling fibroid to use neoplasm. Etiology: each myoma derived from smooth muscle cell, rest either from vessels wall or uterine musculature. Although estrogen, progesterone, growth hormone, and possible human placental lactogen have been implicated in the growth of myomas, the fibroids are often associated with adenomyosis, pelvic endometriosis, PID, pelvic inflammatory diseases. Now, predominantly estrogen dependent tumors, for example, early menarche and late menopause, associated with anovulation and PCOS. Growing in size during pregnancy and following menopause, there is cessation of growth. Nulliparity: a uterus which does not bear a baby consoles itself having a fibroid. Deletions in chromosome 7 and T12-14 are associated with fibroids, more common in colored races. Infertility: fibroids can cause infertility, and infertile women are more prone to develop fibroids. Obesity: but smoking is a protective factor for fibroids. Very important. Smoking is protective factor. Okay. Types of fibroids: intramural, very important, 70 to 75%. Subserosal is 20 to 25%. Submucosal is 5%. Management of fibroids is GnRH analog, most common used, and denazoles also we can use for treatment. Progesterone like Mirena, POP, low dose OC pills, mifepristone, RU486. Fibroids are also partly progesterone dependent. Gastrinone, anastrozole, aromatase inhibitor, esoprisnil, selective progesterone receptor modulator, ulipristal acetate, selective progesterone receptor modulator. Submucous fibroids are located within muscle just below endometrium and distort endometrial cavity. Even a small one may lead to menorrhagia and infertility. Surgery: who does not wish to conceive, family completed, age more than 40. Hysterectomy is indicated for the female whose age is more than 40 or family is complete and she don't want to be pregnant again. Uncontrolled menorrhagia, woman wants definitive treatment. Okay, so if uterine fibroids, patient is asymptomatic. Remember, if patient is asymptomatic, then wait and watch. If patient is symptomatic, two condition: if she is fertile and she desired, if she desired a baby, then pre-surgical management treatment, go with myomectomy if she want baby, long-term medical treatment, or pre-surgical medical treatment or long-term medical treatment. Now, if female do not desire a baby, she don't want to desire a baby, then see, if do not wish to previous uterus, pre-surgical medical treatment or hysterectomy we can go, or for long-term treatment medical. If fertility desire, wish to preserve uterus, we already discussed about this. If fertility not desired, then we can go for hysterectomy or pre-surgical medical treatment, long-term medical treatment. I hope I already discussed a lot of MCQs regarding this. Medical treatment includes fibroid directed therapies like lepristol, acetate, GnRH agonist. Symptoms relieving therapy as listed in table 2. Now we are going to discuss some MCQs here. Female with 3 months menorrhagia, USG, 2 centimeter submucosal fibroid. Answer is hysterectomy. Why hysterectomy? Because female age is 45 years. Female is 45 years old and 3 months of menorrhagia. Submucosal fibroid is 2 centimeter. That's why hysterectomy is indicated, because she already completed her family. That's why the best is hysterectomy. Now select the uterus showing what? This is a picture of leiomyoma. Most common type of fibroid is intramural. We discussed 70 to 75%. Then subserosal is 20 to 20%, and submucosal is 5% something. Medical management of fibroid in all except, that is, misoprostol we are not going to use. We used mifepristone, progesterone, and lepristol acetate. So guys, if you like my videos, put like on it. If somebody is new on my channel, please subscribe it. Thank you. Good day. Goodbye. That's all for today.